Hi, my name is Steve Medeiros, and I'm looking to serve as the next member of the Board of Health. I was born and raised here in Dartmouth, and for me, that has always been a sense of pride. I feel like being a member of this community has really made me who I am today. And after being a part of this town, and again, I feel this town to me is one of the hidden jewels of the state. I feel that most people don't even know the kind of things that this community can offer. I graduated from Dartmouth High School. I went out to school in Boston. And after moving back down here to the South Coast, I met my wife, and we had always made it a point that we said as soon as we want to start a family, we're going to move back into the town of Dartmouth. So back in 2007, my wife and I purchased a home in Dartmouth, and we started our family. And we now have our son Tyler, who's 5.5, and our son Nathan, who just turned 4. And Tyler's actually already been enrolled in the school system here. He's been in school at Cushman as a preschooler, and now he's there as a kindergartner. And when I first moved back to the town, I said, I want to get involved in the community in some way. So I took out papers, and I was able to serve as a town meeting member for the past few years. And then I was actually nominated this past year to the Alternative Energy Committee, where I've served for a little over a year. But why the Board of Health? Why am I looking to serve on the Board of Health? Well, I feel, first of all, my experience from the past year serving on the Alternative Energy Committee has made a really big impact as far as me understanding what issues are facing the town when it comes to alternative energy. And a lot of those issues have come before the Board of Health. In addition to that, I work as a local realtor. And as a local realtor, I've represented a lot of my clients in front of different Board of Healths around the South Coast when they're trying to get a septic system approved. And that's one of the common things that comes in front of the Board of Health. In addition to that, I previously worked over at Charlton Memorial Hospital in the ER for about 4 years, and I think that gives me a really good understanding of what is needed and what's required in the healthcare industry. And finally, I feel I bring a really good, intelligent decision-making process to all that I do, and I feel that that can be a real asset to the Board of Health. So I want to make a difference in the town, and I really think that getting involved by being on the Board of Health is a great start for me to help the town move forward and continue the great work that the other people before me have done. So I'd really appreciate your vote on April 3rd to be the next member of the Board of Health. Thank you very much.